my name is Dr. Yang Linqi. I'm actually one of the pediatricians who's one of the anchor doctors in Thomson Pediatric Centre here in TMC. I specialize in pediatrics and I subspecialize in pediatric cardiologist. That means that I look after, in particular, little children's hearts. I'm also a mother of two, so I have two young children, and that particularly makes me very much inclined to look after my little patients, and that makes me feel what my patients feel, and I like that I can empathize with them much better this way. For common cardiology conditions in children, we can usually divide that into two major categories. So one would be congenital heart diseases, which means that these children are born with these conditions, and one would be the acquired heart diseases, which means that the children get these conditions after they are born. So typically the congenital ones would include most commonly the structural problems. So for example, the child might be born with a hole in the heart, and that would be one of the most common. For example, they have remnants of the fetal circulation. So there are things that are different in a baby when they are inside the mummy, and when you're born, these changes are supposed to happen at birth. In some children, these changes do not happen, and then they have conditions that remain, and therefore they cause problems because these holes and these blood vessels are supposed to close, but if they do not close, then they cause extra communication between the left and the right side of your heart. Acquired conditions would then include things like, for example, Kawasaki. That would be the most common acquired condition in our children's population in Singapore. Kawasaki is actually a very Asian condition. It causes high fever, and it's a fever that lasts for more than 5 days typically, and it has a whole spectrum of other conditions such as they get red eyes, they get red lips, they get irritability, the child gets rashes, they get very big swelling around their neck. So although uncommon, but it is still the most important thing that we usually look out for in any child that walks through our clinic who presents with a fever for more than 5 days. Normally, a child with heart problems would present with symptoms such as shortness of breath. They might also have a little bit of pallor. They might look paler than their friends. If they actually have a shunt in their heart that allows the blue blood to come across to the pink side, they might actually look cyanotic, which means they have a tinge of blueness in their lips. So oftentimes you might think that they look a little purple. They might also have failure to thrive, meaning that they don't grow as fast and as well as their peers. So even though they take in the same calories, they do not put on weight as well. So really depending on the type of heart conditions that the child has, then the exercises will really differ. So for example, a child with a hole in the heart, then they might not be able to run as fast as a child who doesn't. They might not have as good a stamina as a child who doesn't. And a child who has weak heart muscles would also be probably more tired compared to their peers. A child who would be, for example, if they have a small hole in the upper chambers of the heart, sometimes they cannot do exercises that are of high pressure. So they can't do things like scuba diving, skydiving, things like that. I usually tell the parents, let them decide how much they can do. The main aim for the child is that they should be able to tell you, hey mommy, I'm tired, I want to stop. And the teachers should also allow these children to rest as needed. So we want them to push themselves to their own comfort zone. We don't want them to go beyond that. So we don't usually encourage them to do too much of the competitive sports, just in case they get too breathless, but in order to win the medal, they really try to push themselves beyond. But we like them to still exercise, still be comfortable, and you'd want them to actually maintain a healthy lifestyle, not too sedentary. I think there are many inheritable heart conditions, but honestly, most heart conditions are really not exactly inheritable. So a lot of times mummies come in asking, what did we do wrong? Was it something from us? And actually, honestly, most of the time it's really not from the parents. Yeah, but of course there are some that can be inheritable. So for example, there could be cardiomyopathies where the family might have a history of weak heart. So if you do know that your family members, grandparents, great-grandparents, anybody in the family who have a weaker heart muscles, then you might want to screen your child earlier. So I would always tell the parents, a lot of times it's not something that you have done, something that is related to you, but it just happens, and we will do our best to work well with this child, and we do what we can for this child. So if you have any concerns about your child, please feel free to bring your child to see us in Thomson Medical Centre. We have a very wide spectrum of child specialists here in Thomson Medical Centre, and we also look after all sorts of pediatric conditions. We also have pediatric surgeons who can perform surgeries here, and now we also have a pediatric cardiac surgeon here, so we can even perform cardiac surgery for our children too. In Thomson, we have a very comprehensive spectrum of capabilities and also facilities for children's care. So definitely, if your child has any medical conditions or you have any worries for your child at all, Thomson would be a place that you can have reassurance that we will look after your child to our utmost best efforts.